Robert is a motocross enthusiast, but a bad accident on his bike left him suffering in pain for decades.
I've raced motocross from probably I was 17 to 22. Broke a lot of bones racing motocross. How I hurt my back was I crashed on a dirt bike doing some big long jumps and just didn't make it. So it was pretty traumatic. Kept me in bed for 2 weeks without being able to move, go to the bathroom or anything. You know, it was terrible. Lots of pain. So it's been over 25 years that I've been dealing with some pain with the back problem in the lower leg.
Robert's severe pain started in his low back and radiated down into his leg. This made it a challenge for him to live his athletic lifestyle, as even everyday activities like walking became difficult.
Most of the time when I get laid up with the pain, it goes just down my leg and makes my back hurt. I can't bend over. My muscles tighten where I walk sideways. I can't walk straight and level like most people do. I'm walking on an angle where I almost need a cane.
He tried a number of conservative treatments such as ice, over-the-counter medications, and chiropractic care.
Anytime I get in my truck, I turn the heated seats on, and I've had chiropractic care for the last 25 years where they've just kind of kept me moving around, I would say.
Searching for an end to his pain, Robert went to see a local surgeon, and they recommended a spinal fusion.
The last doctor I went to 6 months ago told me he could put rods in my back and plates and kind of screw my bones together and kind of tighten it up, and I told him no way.
Still in pain, Robert went back to his chiropractor and they suggested he search for alternatives to traditional open back surgery.
He told me basically the last chiropractor I go to is a friend of mine, and he says, I can't heal you. You really need to go look at talking to these people.
Based on this advice, he went on the internet and found the Bonati Spine Institute.
And actually there's a couple people in my area that had it done. They came here and had good success. So I said, if they've had the success and what they said online, I'm going to try it out. I actually got them an MRI I had done last year, sent it to them. They reviewed it, and they said you would probably be a good candidate.
At the Bonati Spine Institute, patients undergo a thorough evaluation, including blood work, a physical exam, and if needed, MRIs and X-rays are performed at the on-site imaging center. A surgeon then goes over the images with the surgical guest just a few minutes later.
Everybody on the staff was very helpful and real nice, and I feel like I was getting a checkup for everything. My EKG, blood work, I guess they were checking my kidneys, all that, and then I had to get an MRI where they really checked the main areas and found out where my damage was on my back, and the doctors were real knowledgeable.
The white stuff is cerebrospinal fluid, so that's basically water, and the rest of these things are the nerve roots trailing down.
Okay. We did the MRI on site here at Bonati. It was great. We just walked right across to the other building and went in there and got it done the same day. They came back and read it to me within an hour, and that's pretty amazing because most of the time you get an MRI done, you have to wait a couple days before you can get anything, so that was pretty cool.
The patented Bonati Spine procedures are performed using conscious IV sedation. This reduces the risks associated with traditional anesthesia. While in a twilight state of awareness, patients are kept comfortable and able to communicate with their surgeon.
I got right up right after drank some water. The ladies got me up and walked me, make sure everything was good. So it was pretty cool that I just got right up after having some back surgery. Oh yeah, I could tell there's a difference there. My right leg felt a lot stronger too.
All of the Bonati Spine procedures are performed on an outpatient basis, meaning there is no hospital stay. In addition, no braces or physical therapy are required after surgery. Instead, patients are told to walk a few times a day.
We had the surgery done. We went back to a hotel, didn't have to stay on site. So when I left Bonati Spine Institute, I basically could just walk out the door. I didn't have to deal with any back braces or canes. I wasn't walking crooked, I'm walking straight.
Now out of pain, Robert is excited to return to his active lifestyle and recommends the Bonati Spine Institute to anyone in search of permanent pain relief.
It's a great place to go. I highly recommend it. To come to Bonati, the staff was great, everybody was great. The facility was the cleanest place I've been to in a hospital type state. I've never seen, everybody was great, so I highly recommend them.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.